The most important thing is, apart from all those things, I want to highlight you. Our aim is to create best professionals. We don't want professionals one among 100. We want one out of 100. So the most important thing, qualification to take up this course, is your passion. You need to be passionate about it because you're going to deal with life. Many of the students, those who come here, I speak to them. I ask them, why do you want to take this course? They say, I want to do service, sir. To do service, you don't have to take this course. There are many courses available. Even non-medical courses are available where you can still do service to people. But this is the course where you're going to change life. If you want to be someone who's going to directly change somebody's life, this is the profession. This is one among the profession which can change many lives. The reason is, don't think only MBBS doctors, MS, MD doctors can change life. This is also a profession where you change life by yourself. How? Imagine a child is born completely deaf to very young parents. Young parents get married with a great dream, right? And they say, oh, I'm going to have a baby. My boy has to go to this school, do that, all those things. And suddenly they discover the child is deaf. It shatters the whole family, isn't it? Right? Now, you are the person who will identify deafness at a very younger age. You are going to the person who will restore hearing. After restoring hearing, you're going to make him hear, you're going to make him listen, you're going to make him speak. Right? Without that, this boy is deaf. He cannot go to normal school. He does not get normal opportunities like how others get in life. He is completely dependent on somebody throughout his life. Okay? And his parents will take care of him as long as they are healthy and alive. After their parents, who is going to take care of this boy? See, the worst thing, I'll tell you based on my experience, is to be a parent to a handicapped child. Even at death, they cannot die in peace. At least when somebody is dying, they should die in peace. எவ்வளோ கஷ்டப்பட்டாலும் சாகும் போதாவது கொஞ்சம் நிம்மதியா சாகணும். Right? The parents of this handicapped child, they can't die in peace because mother is always a mother. Even the mother is 90 years old. The son is 70 years old. It's still a son, right? For him. So mother will die. Who is going to take care of my son after this? So you are a person who's going to change that. Imagine your importance. Imagine who you are. If you are going to get into a profession who is going to change that, you are the person who's going to identify, diagnose, treat, make this child hear normal. The child goes to normal school, child speaks like anybody, child goes to normal college, get normal job opportunity, he takes care of himself and then he takes care of others also. He becomes an independent person. You're going to change the life of the entire family and the generation. So that's your role. Every day in this institute, the place where I'm sitting, every day there is one child's life changes. It is done by our own students. Our students get a lot of practical exposure here. Lot of practical, because this institute has got huge lot of patient load, right? Because so you are the person who's going to change life. A child is deaf, you will be programming on the day you program, and then you switch on the device, the child will hear for the first time. That's a great feeling to see, right? So you are going to take such a exciting profession where you're going to change life of people. So if you want to take it, you need to be really sure that you're committed. You need to really be sure that you will give 100% of your thing. You should be dedicated. One of the fundamental rule to join here is they need to be dedicated. They need to be very, very, very committed. The first priority in their life is patient. The personal and the professional, the personal and the family comes second. Because the patients are coming to you expecting that you're going to change their life. Your priority should be there. See, in this institute, we have very rich patients, those who have their own flight, they fly their own flight and come. There are also poor patients, those who don't have money to even come by bus, right? But for example, you take a brainstem implant or a cochlear implant, which is costing 5 lakhs or 20 lakhs or 25 lakhs, whatever it is. It is free for people, those who can't afford. For people, those who are rich, they will pay and they will get it done from the MUF. For people, those who are poor, we still do it free. How do we do it free? Because the government of Tamil Nadu, government of India, Army, Air Force, Navy, all of them support for these kind of patients to this institute. Any child who is born in the state of Tamil Nadu below the age of 6 years having total hearing loss, cochlear implant or the brainstem implant is done completely free in this institution because the state government is helping.
Okay. Amazing. Amazing.
Right. So that is why we have more patients, because we have a scheme for that. Right. And this is something, and the people those are working here are top-notch professionals. And so you get a good exposure. You learn from them, right? It's important. So it does not mean that, we are a very rich institution or anything. Right? It only means that a lot of work is done in this place, and we get a lot of support. And thanks to the governments, thanks to all the state governments, central government, whatever it is, they're very much supporting. It's a very important thing that we should acknowledge them for that, right? And not even in many countries, not even in the United States of America, government is supporting a brainstem implant program, if you know that, right? This is something which we should be proud of, our people, right? And why do they support? Because, it's support, okay, there is a place in this country where even our children, the citizens of this country who have this kind of problem, can be treated in this place. So they're supporting. Right. So, which means what? The treatment is the same. The treatment is the same. For example, the same cochlear implant, when we started, later when we developed the implant program, Dr. Mohan Kameshwaran and our team, myself and others, we helped different government medical colleges also to start the cochlear implant program. So we didn't keep everything to ourselves. We also helped others to start, because it is not that saying that we are the only one in the world to do. No. You also want the others to do. But the brainstem implant is a different task to do it. So doing it here. So having said that, now I've given you a clear importance of a clear highlight of what this is to be. So as I told you, you need to have a clear passion before you take up this profession. So every time I'm quoting my institute is simply because this is our experience. I can only speak from my experience. Don't think that I'm trying to boast what I'm doing. No, that's not. I'm speaking from my experience for your perspective, to give a perspective to you, so that from your point of view, right, what is required, right? So to put it in a nutshell, the passion is very important to get into this field, because I'll give you a very simple situation. We get a lot of patients, not only we, every institution which is get a lot of patients. Some of the patients comes with simple problem which can be treated. Some patients come with very major problem which cannot be treated in any place for that matter, right? But imagine, there are problems. For example, a child with cerebral palsy, child with Down syndrome, right? You can't cure them. Definitely you cannot cure them. Everybody knows that. Even I know that. The parents also know. Despite, the parent will bring the child twice or thrice a week, to this place. The child, the boy, maybe 10, 12 years, he cannot walk. The mother will carry it. Is a very pathetic sight. Will bring the child for what? As long as he is there, let him have some good quality of life. That's only expectation they have from you. If they have so much of expectation from you, I think you should have a great dedication towards it. And this is not for this profession. For any medical profession you take, please be dedicated before you take it. Don't go with the mind that, I will get a job. Job you'll always get. Everybody has got a job to do. Right. And the question is, as I told you, how fast you can achieve what you want to achieve, which has got more opportunities, which has got better scope, may vary from profession to profession. But at the end of the day, if you want to reach on top, what is more important is hard work and dedication is very important. And especially in this field, it's even more important. As I told you earlier, who is going to judge you? Your patients are going to judge you. If you're not dedicated, if you're not clinically skilled, if you're not knowledgeable, if you don't have a human nature, patient will never appreciate you. They will never come to you. Right. So there may be 100 audiologists, speech pathologists, or there may be 100 cardiologists in a city. but only one cardiologist or two cardiologists are rated top. But the degree is the same. The same degree, they might have all the 100 cardiologists must have obtained the same degree. But why only 2 or 3 people are sitting on the top? Beyond the degree, there are certain qualities that is important to reach top. Not just the degree. Don't go for just getting degree. Right? There are so many things that, and all those things are taught in this institute. Right? And this is important. Your clinical exposure is important. Your the way you deal with patients are important. The protocols that is built is important, and also the different varieties of patients you see is important. These are the things that is important to make you grow. Right now, there are a lot of institutions which is also doing very good work in audiology, speech language pathology. Right now, the thing is, in every institute, the point is you need to go and join with the dedication. Okay, so one institute may be different from other. This may be good in that, that may be good in that, and all. Let's not get into it. Okay, it is a diversification that's in every profession, every college, every departments. That's not the point here. The point here is this is a good profession. This is a very good field. There's a huge scope. The level of audiology is just not testing hearing. It is much beyond. It's a very futuristic, right? And it has been rated one of the top 5 professions in the world. And there's a huge demand all over the world. All our students, much before they finish, they're employed. Either they have the plans to employ themselves, or somebody recruits them. They are being grabbed by some big hospitals or big companies, or they have opportunities to fly outside the country, right? So this is a profession where these opportunities are available. Okay, and I'm not saying that doing audiology is the only best program. I'm saying audiology is one of the best programs. But what I wanted to highlight here is when you take up this profession, take up with a passion. Just don't take up with the idea of earning money. Because when you have a passion, money will follow you. When you start chasing money, the money will run away from you.
Absolutely.
Correct. So you should be passionate so that people will come to you. You can achieve what you want to achieve in life.
Okay. Great. Wonderful, sir. Amazing presentation. And I think most of you, I think most of the participants would have understood what exactly the scope and opportunities of audiology, speech, language, the whole BASLP, what kind of opportunities are available. But participants, if you have any specific questions, you can post it in the chat box, as well as you can, if you want to talk to Professor, you can just raise your hand.
If anybody wants to ask a question, wants to talk to me, please feel free to talk, because we encourage communication.
Yeah, exactly.